Hey, welcome back to today's Mobility Monday. I'm Jeff Blanchard, physical therapist at Therapeutic Associates. And today we're going to talk more about hip pain in a different location. We're going to be talking about the front location of hip pain, where it's coming from possibly, how you can figure out what's going on, and what you might be able to do to start getting it feeling better. Okay, so we talked a little about this briefly in one of our previous episodes where we talked about the different locations of hip pain. So just a recap, the front of the hip, oftentimes we've got something going on at the hip joint. Now there is a muscle that sits in front of the hip, and that muscle is called the psoas muscle, spelled with a P-S. And that muscle comes all the way through the pelvis and it attaches to the spine, and it attaches to this little spot right here at the femur. And so it lifts your leg up into this direction. So that's what the psoas does. Now sometimes you can get pain in the psoas and it'll actually go into some tightening or some spasm. And we'll notice that one psoas feels super tight versus the other side. Now, usually when that's going on, that's pointing us to a problem in the spine. So we can have a problem back here, which is going to cause that muscle that goes from the spine to the front of the pelvis to go into spasm or to get tight. And that can give you this kind of deep, achy pain in the front of the hip. That can actually be resolved at times with some work on the front of the hip. You might see a massage therapist or a physical therapist who can work on getting this muscle to let go by using some pressure techniques. There's also a way that you can stretch this muscle, which to try to help open it up a little bit. We've done that stretch in the past where you're kneeling on one knee and you're stretching forward to get this muscle to stretch out. However, if that causes you more pain, do not do the exercise. That is one of the cardinal rules that we teach our patients. If an exercise causes you pain, do not do the exercise. Come in and see us and talk to us about it so we can help guide you through that. Okay, so that's just a little bit about the psoas muscle, which sits on the front. Oftentimes, again, it's more of a deeper issue, especially if the pain is feeling kind of pinchy. So when people get this front symptom, they'll say, I got this groin pain and it pinches me every once in a while. I might turn and it pinches me, or I do a certain thing and it gives me a pinch. So usually that's something going on at that hip joint. So if you're an individual who's say 45, 50 plus, then more likely we've got some breakdown of the cartilage. When there's breakdown of the cartilage, the ball and socket gets more kind of compacted, and there's just less space in there, so things can get a little bit more pinchy in that area. So if that's going on with you and you happen to twist on that hip, you might just feel a shot of pain go through that area. Another thing that you might try is you might try bringing the knee to your chest. So if you were to say lie down on your bed and pull that knee into this position, if it feels kind of pinchy, then it's probably that's what's going on. That hip is not able to fully close and get into this position, especially if you pull your leg to the midline. If you pull it up and pull it to the midline, and that causes that pinchy sensation, again, that's probably coming from the hip joint itself. We're actually putting too much pressure on it, causing some of that pain. So if you're dealing with some arthritis in that area, what should you do? Well, if it's not that bad, you might try a couple things to just lubricate the joint. The number one best thing that I believe you can do to lubricate the hip joint is get on a stationary bicycle. Get on a stationary bicycle and just pedal, pedal, pedal. You don't need to put a lot of pressure on it, so don't ramp it up really, really tight, but just get that lubrication, just get that motion. And that can oftentimes help that hip feel better because it's doing that just gentle range of motion. Remember what I tell you all the time, motion is lotion, because it is. And so that gentle motion can help to lubricate that joint. Another thing that you can do is you can do gentle strengthening exercises. in a position that does not get you into too much of this. And so like I wouldn't want to have you doing deep squats or something like that, because again, that's bringing you up into too much of a pinchy position. But you might say do some of these things where maybe you're doing some leg lifts here to the side. That's going to be okay. Or you might do some of these clamshells that we've talked about and we've done in the past. That would probably be okay. Or you could probably do some of these glute bridges that we've talked about in the past, really working on getting those glutes to wake up and get those glutes working. That would be a good exercise to do as well. All of those exercises would probably be okay with some osteoarthritic changes going on in the hip. If you find that it's more bothersome or those don't help, come in and see us. Get in and see your physician. Bring this up. Your physician might order an x-ray to take a look and see how much space you have in that hip to then better discuss, is this a physical therapy approach or is this more of a surgical approach? So what if you're younger than 45, 50 plus, and you're getting this pinchy pain? So we spoke briefly in the past about the anatomy of this joint and how sometimes we're just built differently, and some individuals have a deeper socket and some individuals have a bigger, fatter bone that goes into the socket. Both of those conditions will cause an impingement to occur. So impingement is when the joint gets pinched and compressed as the leg or as the bone is going through a certain range of motion. So what do we do if that's the case? Number one, stop doing what's causing the pinching. That is the number one thing. If you're doing a sport and you're getting pinching, you can't do the sport. If you're doing some kind of an exercise routine and it pinches that area, if you keep pushing into it, you're just going to irritate it. It's going to get more inflamed. That's going to increase your likelihood that you're going to have surgery for this thing. So the best case scenario is, again, just gentle range of motion. Get onto a bicycle. Probably cycling will be okay. Some of those exercises that I just talked about, you could probably do some of those exercises because, again, you're not closing the joint up too much, which is going to help keep that joint from pinching too much. And come in and see us and see what we might be able to do to guide you through this process to see if we can actually avoid a potential surgery. Sometimes we can, sometimes we can't. In the conditions where we can't, then maybe we might be able to recommend a good surgeon for you to go see and have a consultation with to see what does this look like, what does surgery look like in order to actually resolve this impingement syndrome that's going on at the hip. And I also talked a little bit about the labrum of the hip, which is that cartilage ring that goes around the hip. That's another spot where sometimes the labrum will get disrupted, which will create a very similar condition with the impingement. It'll feel the same thing, but you might feel a click when you go through the motion. And so it might click one way and click the other way. If you're noticing that clicking and popping, that might be the labrum, or it might be the psoas. So if the psoas is too tight, it also can cause something called snapping hip syndrome, where if you move your leg around, you'll feel what I would call a clunk. A clunk is a deeper internal feel. That's less of an issue. Usually we can improve that by strengthening your core and working on the psoas, versus a click, which feels a little bit more in the front and is a little bit of a less deep sensation. So you'll know what I'm talking about if that's one of the issues that you're dealing with. Regardless, oftentimes there are a couple of things that you can do at home that are gentle, that are going to be lubricational, that are going to help to get that joint to be lubricated, that will hopefully help calm things down. Again, make sure you remember to avoid what is painful. Sometimes the stopping the behavior is more important than starting an exercise to actually help you get over a problem that you're dealing with. So you might want to make sure that you're keeping that in mind. Maybe there's something I need to stop doing so I don't continue to rile my hip up if I'm having pain in this area. So thanks for joining me today for today's Mobility Monday. If you enjoyed the episode, share it with a friend. If you know somebody who's dealing with pain in the front of their hip, suggest that they watch this episode. And until next time, remember, motion is lotion.